Oftentimes in oncology, we are under the basic premise that patients usually ask the questions for which they can handle the answers. And pancreas cancer, obviously, it will be diagnosed in some form of an acute event. So the patient will either have abdominal discomfort that is bothersome for weeks that eventually leads to the diagnosis. They'll become rather suddenly yellow or jaundiced, so the whites of their eyes become yellow. But the diagnosis occurs usually within the period of a few days or perhaps a week, where the patient goes from knowing that something is wrong to I have cancer, and not only that, but I have a cancer that is difficult to treat and the fourth leading cause of adult cancer death. So it usually takes a while for patients to be able to assimilate this and come to grips with this in the best way that they can. So it's fairly common that the patient will not yet be ready for answers to some questions that will be the first questions that a family member would ask. So this would probably be the first question that you would ask me if your dad was sitting next to you, but your dad may not be ready to handle the answer to that question. And I think it's important that family members understand this. So one thing that I would recommend is that the family gets together before the doctor visit. I would never let a member of my family go to a doctor visit of this magnitude alone. There should always be at least one person with them. That person should have a pencil and a pad of paper. But I think talk through some of the questions beforehand and make sure that the patient is accepting of the questions and certainly then the answers. With that said, there is no way that any physician can predict how long a patient will live. All that we can do is provide average information as a guide. So obviously people who develop this disease usually are older. Many of them still have significant responsibilities. Some people will not, if you can believe it, will not have a will. There'll be many issues with regard to their own personal finances, their home, all of those things that will need to be dealt with. So clearly, the doctor has a responsibility to patients to let them know the gravity of the situation. For those of us who deal with cancer every day, or for any person who has a job which makes one realize how fragile life is, the world is oftentimes ready for our departure at any time. So for example, in my own personal situation, the world would probably do just fine if I were to leave tomorrow. By that I mean that from the standpoint of my personal family, my will, all of those things are up to date. But that's very uncommon for most of the patients that I would see. But to specifically answer your question, we can provide general guidelines with respect to stage of disease. So for example, if we have a patient with a localized pancreas cancer that we think is potentially curable, we're obviously treating them to cure them. That is the goal, that they will be cured of this disease. If we have a patient whose primary cancer in the pancreas is too big to remove, but it has not yet spread to any other parts of the body, this would be a stage 3 pancreas cancer. The average length of survival would be in the range of 1 to 1.5 years. But that means that there would be many patients who wouldn't do quite that well, and then there would be some patients who would do much better than that. So to give a patient sitting across the table or right next to me an estimate that they would live just 12 months could clearly be wrong. For a patient who has pancreas cancer that has spread through the bloodstream to other parts of the body and is now in the liver, possibly in the lung, the average survival of 100 patients with that stage of disease would be in the range of 6 to 8 months. But that 6 to 8 month range could be very wrong for one individual patient, and I think that's what people need to understand.